Good afternoon, good evening, everyone, and welcome to the podcast. And today we're joined by specialist sport and MSK Dr. Lorenzo Masci. So, Lorenzo, thank you very much for joining.
Thank you very much for having me.
No problem. So, before this, I will say I'm springing it on him, but he's told me that he can't believe anyone is interested in hearing anything about his life. But I've insisted that there definitely will be a lot of people interested.
Well, the legal aspects.
But no, thank you for joining. And we first met in inverted commas last year, but I've come across your name a lot. But I'd be really intrigued to just know where you're from originally. You obviously can pick up on the accent, but tell me about where you're from.
So, obviously born in Australia, I have Italian heritage. So my parents are both Italian, and they came over. Well, they moved with my grandfather and grandmother over from Italy. So it was just after the war. There was mass immigration out of Europe, and my family for some reason picked Brisbane of all places. But we ended up there, and really, that's where I grew up. I grew up in inner city Brisbane. In the mid to late 70s, 80s, and went to school there, obviously, and then decided, of course, on medicine. So that was after school. Was where I went into.
Yeah. So what prompted that then? Why medicine? Do you have a background in that from the family?
No, actually, no. My parents are working class. I don't know why, really. I just sort of had an interest in it, and I thought, looking back at it, I thought, I enjoy sort of biological science, and I was 16 at the time when I went, because I actually started school early. I graduated when I was 16, and really, you don't really know what you want to do at 16. So, and this is the way I looked at life in general. I'll just give it a go, and if it doesn't work out, it doesn't work out, and I can always do something else. So I decided, I'll give it a go, and I started med school at. I literally went to the university. I was 16 years old. Started med school, so it was quite an interesting experience. But I really didn't really think about it, and really, would you ask a 16-year-old, what about careers, or about what you think you should do? Probably not. So I sort of just fell into it, thinking, I'll see how it goes, and if it doesn't work out, I don't like it, I'll just move on to something else. And that's really been my mantra throughout my whole life, really.
Right. So is to clarify, in Australia then, is it 18 the same as here that you would normally go to university then?
So back when I went to school, it was actually that you started school quite early. So I was sort of just turned 4, and then by the time I finished school, it was 16. I was 16 going on 17, going to university. So I think it was a little bit younger. I think they've changed it now. They've made it. I think it's a bit older now. But at that time, it was just because I was born at the end of the year, and so I was 16 going on 17. Started university just as I turned 17.
Yeah.
So it was interesting time. I mean, it was in the sort of early 90s when I did med school, and I wasn't sure what I exactly wanted to do, as far as if I wanted to do a specialisation or doing general practice. But I also always had the interest of sports and exercise medicine. I always kept fit. I played a lot of sport. Wasn't particularly, a devout sportsman, but I played a lot of tennis and just kept fit and liked physical education, and just enjoyed sort of biological sciences, and then through medicine, I always enjoyed, the musculoskeletal side, the fitness, exercise, physiology side of medicine. In fact, I wanted to do human movements when I was in med school, thinking, God, I'd like to do human movements. That would be really fascinating to learn about the muscles and how the biomechanics and lots of different areas. And so, I finished med school, and then really in Australia, what you do, and I think it's similar here, is where you become a house officer, and you move through rotations. I thought about orthopedics for a little while, but I just didn't really, and that back in the 90s, didn't really enjoy the culture of orthopedics that much, and I just didn't think it would suit me as a profession. So I quickly gave that a swerve, and then it was interesting. I then decided to do some general practice, but at that time, and that was sort of, near 2000. Sports and exercise medicine was really coming to the fore in Australia. So the college there started back in 1985, the Australasian College of Sports Physicians. And, I was just one day thinking, you know what, I'm just going to contact them and see, just give it a go and see what they say. And, the lady there was really helpful. She was the chairwoman, I think, of the college, and we're discussing how you'd go in a career of sports and exercise medicine. And she said, well, you had to sit a Part 1 exam, and after you sit the Part 1 exam, then you apply to the college and so forth. So I just woke up one day and thought, yeah, I want to do that. I'm going to do that now. So I started studying for this exam, and it actually took 6 months to actually prepare for this multi-choice exam, Part 1. It's a very, very difficult exam. And, I was thinking to myself, do I really want to do this? And I didn't really even think twice. I thought, yeah, I actually do want to do this. This is sort of the career that I want to get into. In that time, actually, sports and exercise medicine wasn't particularly prominent. And there were a lot of doubts about whether you could get jobs as SEM consultants. And even in Australia, it wasn't recognised as a specialty. But, I thought, I'm just gonna go for it. And if it doesn't work out, I'll just do something else. I'm sure there'll be something else that I'll fall into. So I did the exam, passed the exam, and then applied to the college, and then got a position in Melbourne. So from that point, I then decided just to move from Brisbane. There were no positions in Brisbane at the time when I applied. So I then took all my stuff. I didn't have any dependents at the time, and just moved to Melbourne. So I started training in sports medicine in Melbourne.
So Melbourne, arguably the sports capital of the world. That is just incredible.
I mean, Melbourne, just absolutely amazing. It's an amazing city, but for sports and exercise medicine, I would argue probably one of the eminent places to do sports and exercise medicine. Literally, I was surrounded by experts, world experts in different areas, hip and groin. There was a sports physician who was Karen Holzer, who was expert in exercise-induced asthma. And then you've got this plethora of expert physiotherapists. I was lucky enough to work in Olympic Park sports medicine, Alfredson sports medicine. I basically worked everywhere, and it was interesting. Each clinic had their own little specialisation. So Alfredson had their specialisation in basketball and dance medicine and gymnastics. And then, I'd work there, say, in the morning, and then in the afternoon I'd go to Olympic Park sports medicine, where the emphasis there was on athletics and Australian football and rugby. So you'd get this such diversity of training. It was absolutely amazing. And, I owe really my career to really the sports medicine community in Melbourne, and particularly Olympic Park sports medicine and Alfredson sports medicine. Got a really, really good grounding, absolutely loved it. And it was just fantastic training.
So was it difficult to get a place there coming down from Brisbane? Was it competitive?
At the time, I was a little bit lucky because I didn't have a lot of training in sports medicine, I must say. I did spend some time with the sports medicine physicians in Brisbane. Didn't have a lot of time, and it was a little bit political because obviously they would pick and choose their own people from Melbourne and Sydney. But I impressed the interviewers enough to squeak through the process, and they offered me a job in Melbourne. They said, well, we don't have a position in Brisbane, but I think you've got a position. Do you want to move to Melbourne? And I just said yes, I'll move. I didn't worry me where I moved to, really, because I knew that this is the career I wanted to choose. So so I did. So it was just interesting. The medical training there, the sports medicine training, was 4 years, and you had to do a year outside of Melbourne. So you had to move. So I moved to Canberra and spent some time at the Australian Institute of Sport and clinics associated with the Australian Institute of Sport, which was again a fantastic experience, and being around really experts and world experts in areas of sports and exercise medicine. And did a year in Canberra, and that was fun too. Change of scenery, change of people, different sort of different approaches. I worked a bit in the hospital there as well, and A&E in the MSK department, and that was quite interesting. So I was a bit more senior then, so I had a bit more knowledge. So I mean, overall, I think the training in Australia was just fantastic, and it really gave me a good grounding for my career in sports medicine. So that finished sort of 2005, 2006, and it was quite interesting. I was set on a position as a consultant in Melbourne, and I got a call one day from an Aussie chap called Andrew Willett. So Andrew, he, at the time, was the founder and CEO of a clinic called Pure Sports Medicine, and they have you've probably heard of Pure Sports Medicine. They have quite a lot of clinics in central London, and I got a call from Andrew Willett, and he wanted to know whether I wanted to meet up with him just for a quick chat about a potential place or some work opportunities in London. And I knew that Andrew at the time, Andrew Willett, and certainly my colleagues were talking about Pure Sports Medicine and how they were setting up practices to emulate the setup in Melbourne. So the multidisciplinary sports medicine clinics, we have doctors and physios and podiatrists and dietitians working together. So I was interested in that. So I remember the day I met Andrew. I was in a bit of a fluster, and I think patient was late or something was happening, and I sort of ran upstairs because I was a little bit late, and I said hi, and I saw this guy with typical Aussie guy with really shaggy hair, and he said, "Hi, I'm Andrew," and it was quite interesting. I said, "Hi," and we discussed the opportunity in London, and at that point I thought, you know what, I'll just give it a go. I mean, there's an opportunity there to take again. I'll go with it and see what happens. And so Andrew said to me, "Look, why don't you come over to London and just check out the clinic and meet a few of the other people, a few of the directors there." And I thought, I'll just go to London for the weekend and just I had to actually also get my GMC I had to put in my GMC application, and you had to go there in person to do that. And at that time, they were a little bit strict about GMC, and you couldn't apply for it online. You had to actually show up in person to present yourself. So I actually went to London for a whole weekend, just for a weekend, to meet up with the team at Pure Sports and to get my GMC recognition. And so I thought to myself, why am I doing this? This is just nuts. I'm literally going to London for a whole weekend, flying in Friday, flying out Monday, to go to some place that I probably will never go, to get some GMC recognition and spending a couple of $1,000 on a flight. But I thought, it feels good. This feels right. Something's right about it. I'll just go with it. And if it doesn't work out, then it's been a free trip not a free trip, but a trip to London, which was fantastic.
Yeah. Did you was there anything in particular that Andrew had said that made you thought it was going to be an exciting opportunity?
Not really. I mean, it was not particularly. I mean, he's very charming and very persuasive and very encouraging. And so there was nothing particularly in what he said. I just thought, you know what, I'll just give it a go. I mean, I finished sports medicine. My view was I'll probably go for a year or two, and then I'll just come home and restart my career and build up my networks and so forth. I really wanted to spend my idea of coming here was not just work, but also to experience living in the UK and living in Europe and traveling in Europe. And that was, at least 50% of the reason why I was coming over. Because I thought if I didn't do it now, I probably would never do it. And certainly if I had a family or, settled down, it would be more difficult to move. So I just made the decision that I'd go, and it was just a confluence of factors, and it just went in my favor actually. And so it was quite interesting. I went in March, and I was thinking, look, I'll probably spend another year in Melbourne, because I was working at that time, working for the Melbourne Storm Rugby League team. That was really the first team I started working for. And I had to finish the season, and so sort of waiting for that to happen. I had a great career in Melbourne, and I could have stayed there and really just continued. I was working at Australian Open tennis. I was really lucky to get a place there as a registrar, working at the Australian Open. I worked there for 7 years, and that was actually one thing that I really regretted about leaving Melbourne, was actually having to give up that opportunity of working at the Australian Open. But I thought after 7 years, because I'd been working there for 7 years or 6 years, I thought that was probably time to move on and do something different. I was working at Melbourne Storm Rugby, so I worked in the Rugby League. I also did a year in Australian football in Australia. So it was 2000, and it was about 14 years ago, 13 and a half years ago, that Andrew said, "You've got to come now, otherwise," I think he said, "otherwise I'll give the job to someone else," or, we need someone now. So I thought, okay, well, that's it, let's go. So off I went, just by myself, packed my bags, said goodbye to family, friends, and one-way ticket to London, thinking, what the hell have I done? And arriving here and thinking, shit, what have I done? London's a tough city, right? So it's interesting culturally. We think Australians and the Brits are similar, but actually the cultures are very, very different. And it took me a while to sort of get used to the nuances of British culture. There's some really good things about it, and then some things that I was a bit confused about. So it took me a little while, but I was definitely in culture shock for about 3 months, and then settled in, and it was good. And I started working at Pure Sports Medicine.
Based at? Where were you based with them?
Primarily based at Kensington, but they moved me around a bit, which was fantastic. I worked at their Threadneedle clinic, and then I worked a little bit at Canary Wharf, and they're a fantastic group of clinicians and physios, and it was really good time. My favorite time was really Canary Wharf, where we had such a great group of practitioners at the time. This was almost 10 years ago. We had Australian receptionists who were just absolutely bonkers. They were crazy. And it was just like going to work and it being a party day every day. It was serious stuff. We'd see patients, but at the same time, we would have quite a good time. And it was very good, and I really enjoyed myself. I had lots of opportunities, and that's the thing about, I think, work in the UK. And people say, why are you here? I think in the UK, there is a plethora of opportunities, and I think you'd probably see it with your work, Andy, Australia is quite isolated in a lot of ways, and it's only when you move out of Australia that you realise how isolating working in Australia is. And really in the UK, living in London and working in the UK, you're exposed to so many different points of view, and not just in the UK, but also in Europe, that it's hard to be isolated, and you're exposed to lots of different opportunities. And for example, at Pure, I was lucky enough, and it was just pure luck really. I was lucky enough to get a position at Fulham Football Club. I worked there for 3 years. That was fantastic experience. I worked with really good sports physician, Steve Lewis, who was the primary sports doctor there, and had a great time. Fulham Football Club at the time, and they're in the Premiership at the moment, but we're going through, a bit of a difficult time, but it was fantastic experience, fantastic to be involved in football and soccer at that time. And I had a great time. And then also, meeting up and then ended up working with Professor Hakan Alfredson, who it was a bit of luck there, where I started working at Pure, and Andrew Willett and Pure had asked Professor Alfredson, who is a well-renowned tendon expert, to start consulting at Pure as well. He used to come in every 6 to 8 weeks and do a tendon clinic, and I just said to Andrew, I want to work with Hakan if I can, and that's where we started this fantastic working relationship, and now really a friendship. He's a great friend and fantastic practitioner. Mm-hmm. And so that's where my interest in tendons really started. Actually, it started before that, because I actually worked at a clinic in Melbourne at Alfredson Sports Medicine, and that was really where Jill Cook, Ebony Rio, Peter Maliaris, these are all big names in tendons. And, I was just lucky enough to be a, small-time registrar, training sports medicine practitioner, working with these massive big names. Even at that time, this was 20 years ago, and Jill at that time was talking about tendinopathy and really the principles, while they've changed, the principles have been fairly similar. So I fairly similar back then. So I was really lucky enough to work with some of the big names in certainly in Australia in tendinopathy, and also in other areas as well. But my interest then changed when I started working with Hakan Alfredson, and that's where I got involved in a bit more research, and we obviously dealing with lots of sort of innovative procedures for tendons, and published now probably about 15 to 20 papers with Alfredson. So. And then that was a really fantastic experience. And that was primarily because of, if you trace it back, it really was Andrew Willett and Pure Sports Medicine that gave me the opportunity. Mm. But, really, really good. It was just a confluence of factors, bit of luck, maybe being in the right place at the right time. So that's sort of what happened. So it keeps going. And then at that time, I decided, so I'd done 3 years of Fulham Football Club. The relationship had ended between Pure and Fulham. And at that time, I'd sort of stepped in. And again, it was a little bit of luck, where a job came up at Wasps Rugby and for a sports physician, and I sort of jumped onto that. And so I ended up spending 5 or 6 years at Wasps Rugby. So by the end of it, I'd done all the different codes of rugby and football, Australian football, rugby league, rugby union, and football. Proper football. So I'd actually done the full codes, and then I decided to hang my boots up a couple of years ago. Wasps decided to move up to Coventry, and it was too hard for me to do it. So
was that a conscious decision then for you to move into different sports, or was that circumstance, or what was it?
I think it was just circumstance. I think you just take the opportunities that present to you. I think you grab them, and I just went with it.
Yeah,
and really enjoyed it. And I think it gets better as you get more experience. That's the key. So I remember doing rugby league at Melbourne Storm, and that was just a fantastic experience. But really, I was very, very junior at the time, and thinking back, thinking back of what I used to do then, I was thinking to myself, God, I took so many risks that I wouldn't take now, and it's just as a result of knowing a lot more and experience and knowing when to take the risks and not when to take the risks. So you become a little bit tempered in your risk taking, as far as can a player play? Can you do an injection? What other treatments can you do? Can you rush them back? Can you not rush them back? So forth and so on. So just experience. based on experience.
Yeah, and then you mentioned the Australian Open there. So someone who you're a tennis fan, what was that like going in? And that was, I mean, I was at the Open in 2002, so I know how amazing the tournament is.
You went to
yeah,
went to have a look. Yeah. Yeah. Aussie Open's an amazing tournament. And I you know, I'm a passionate tennis fan and player. I used to play a lot of tennis. I remember the first year I was like, oh my God, you know, you sort of that was really the only time that I've been in awe of the people around me and really, yeah, in awe of athletes generally. I mean, I'm a little bit better now. I can take it or leave it. But back then it was like, oh my God, you know, there's all these tennis stars just moving around. But that was amazing. I mean, in essence, what we do is we don't really do that much. We just look after them, patch them up, and decide whether they can play or not. But just being part of the whole centre and seeing how it works is just amazing. I can imagine Wimbledon being even more on a grander scale than the Aussie Open. I actually managed to. It was quite as working with the Australian Open. I got to visit the Aussie Open as well, and went into the French as well. So we just through connection. So it was a really good experience being able to get back seats in a lot of those those big open tournaments. So.
Yeah, absolutely. What you would have timed that exactly with the rise of Nadal and Federer, really. So could you what interpretation of like seeing them come through?
It was amazing. You know, you would see Nadal. I mean, Nadal was quite young at the time, but it was Nadal, and it was actually the same time as you know, the Williams sisters were. I mean, they're still big now. Still, maybe not so much Venus Williams, but Serena Williams was. You know, she was dominating at the time, and also because my childhood idol was sort of Martina Navratilova, and she was still playing doubles at the time. And that was like just amazing to see her play because, you know, I was still very young when she dominated the scene. So it was fascinating, and just seeing them interact with each other and how they do that. Tennis players are a pretty relaxed bunch, really. I mean, everyone's sort of relaxed, and it's in general anyway compared to other sports. But it was really, really good experience. You know. One of the regrets of I think moving to London and having to give that up, unfortunately. The way it is.
Did you see any differences in terms of the athletes, in terms of the way they were? You said the tennis players were relaxed. You've gone through like rugby. Aussies are different breed altogether. But...
Yeah, I mean that's one of the interesting aspects of working in elite sport. I think is that every single sport. Like I worked in weightlifting. So that was interesting. Interesting bunch of people in weightlifting. I worked also in judo. Did work in judo. What else did I do? A few others. Lacrosse. So I did some work in lacrosse, just getting to know. And it's interesting, every sport, even if you take rugby and rugby league and football and Australian football, every sport has a different culture, and you have to adapt to that culture depending on the sport. So I'll give you an example, like with rugby league, literally the players just want to play. So irrespective of the injury, you know, they could have half their face falling off, you know, they could have a broken leg, they just want to play, and you literally have to drag them off the field or tell them, no, you cannot get on the field. So they all their focus is on playing, and that's a challenge because often they hide injuries, and so you often find injuries. By the time you find injuries, they've often, you know, completely torn their hamstring, or they've completely torn their soleus muscle because they've just kept pushing on. So these guys are tough. I mean, I think rugby league is really the toughest sport apart from women's gymnastics. I think women's gymnastics is also pretty tough. You know, some tough women in that sport and men. But as far as the contact sports are concerned, rugby league is really at the pinnacle. And then you've got, which is often quite crazy because you're dealing with, you know, athletes that sometimes you just think, I'm not sure if, you know, they're real people. I mean, they just cop a lot of abuse and, but you know, physical harm, and they're able to push on. I think to play rugby league, you need to be tough. Just need to just need to have that toughness. If you don't, you just fall by the wayside as a teenager. You just don't play. And then you've got rugby, which is the guys want a bit more explanation about their injuries. They want to talk about the pros and cons, about what are the side effects, and so it's quite interesting. You have to play that game of giving them the perception of making decisions, which they are. They ultimately are making decisions. And then you've got football, which is probably one of my least favorite, because it's very political, and you're not making decisions based on the medicine. You're making decisions based on what their agent says that they should do, and so there's probably my least favorite out of all sports, and that was just primarily because I just didn't really. I mean, I enjoyed watching football. I played football as a kid. I enjoyed watching it, and it's spectacular watching a good game of football, but the politics can be quite draining, and then you've got Australian football, which is sort of a mix of all of them together, and different injury, and each of them have different injuries as well. So football is different to Australian football, which is different to rugby, which is different to rugby league. So it's quite fascinating, and they have their own little specific injuries as well for example, with Australian football, you tend to get a bit more groiny overload issues. Rugby league is more trauma related, although you can get overuse issues. So it's all quite challenging. And working through all those codes, you do definitely develop experience in managing a host of spectrum of injuries over many sports. And it's very, elite sport is very good training for, I think, if you want to be a sports and exercise medicine practitioner. I think doing some contact sport is certainly worth your while. Certainly rugby and rugby league, because you see a plethora of sports medicine, and it's never boring. There's always something going on, be it an injury or an infection, or there's some issue going on that you have to deal with, and it can be challenging to work in that environment.
In terms of the way you manage those people, do you think you've developed a lot from that actual social interaction with them and been able to manage them?
So I think so. Yes. I mean, I would say I'm an introvert, and I tend to keep to myself a lot. But I think you adapt according to the sport a little bit. So as I said, rugby league tends to be a bit more didactic. Right, this is what you're going to do. You're going to do this, and this, and that's it. We're not going to compromise on that, because if you compromise, you'll just play and you'll ruin everything. Whereas I think rugby and particularly rugby, you need to discuss the issues with players. Want to be informed, well informed. Football is a bit of a combination. Australian football, a bit of a combination of the two. But certainly you deal with different personalities as well. So lots of difficult personalities, but also pretty laid back personalities, guys that are pretty easy to manage, and then guys that are a bit more difficult to manage. So, it's just life experience really. And I think you get better at dealing with difficult personalities as you become more confident of your abilities. But you also, you're aware of a lot of uncertainties or unknowns about particular issues, injuries, and so forth. And there's lots. We always think we can control things, but I sometimes doubt that we can really control it. We can try and risk manage, but sometimes we can't control things totally, as far as an injury or some sort of issue. We can risk manage, and I think that's my job, is to risk manage. Give people options, risk manage. Sometimes hopefully most of the time you win, sometimes you lose, and that just comes with experience.
Yeah. Have there been any, I'll say athletes, but it could be anyone really, that you've experienced and come across that you've just been like, wow, maybe physically, but also from that kind of mental strength side?
I'm not going to name any names, but because obviously I've seen some fantastic athletes. I mean, Melbourne Storm at the time when I was playing, where they won the premiership, they had some fantastic athletes. I mean, these were athletes. Greg Inglis comes to mind. He was a young, upcoming fullback for Melbourne Storm, and just I've never seen anything like it. He was absolutely amazing. So you end up seeing lots of athletes, and then you see the positives and negatives, and some deal with it a lot better than others, and I think that's the beauty of elite sport.
Yeah.
So I also got into, and the other thing with the UK, we talk about opportunities. I just want to mention this because I know you're involved in this, Andy, is doing ultrasound and ultrasound guided interventions. And how I got into that was actually I was actually working, because I work at the military as well. I did some work at the military, and I had this ultrasound machine sitting in this room doing nothing, and I thought. I said to the physio, what's that doing there? And he said, well, they bought it, but no one's using it. And I thought, I'll just start using it. And I started using it thinking, I'm not going to use this very often. And then thinking, actually, this is quite useful. It's allowing me to see things that I wouldn't normally see on doing an assessment. And that's where I ended up meeting a lot of the, I call them the godfathers of ultrasound, John Leddy, Chris Myers, who you know as well. And we actually started up a group about 10 or 15 years ago, about 10 years ago, just after I came here, just getting together and doing ultrasound scans. And it's at that time that Chris started his business of Smug and just starting at the time. And that's how I got into ultrasound, and then it just sort of ballooned from there. And I've been teaching ultrasound now for 7 or 8 years, and helping Smug and doing a lot of sort of diagnostic ultrasound and ultrasound guided injection. So yeah, that's the other thing about the UK is in Australia, unfortunately, and I still think it's like that a little bit. It's a little bit more restricted, and for various reasons. But in the UK, there's this opportunity to explore areas that you wouldn't be able to normally explore in different settings.
And so had you not done much, education on ultrasound previously?
Well, I mean, part of our training in sports medicine was to know about ultrasound. So we would see the radiologist do ultrasound, but it wasn't part of my training. So I only started training when I came to the UK. So first I think it was the first year or two, seeing that ultrasound machine in the military, and then actually getting hold of the machine and starting to practice, and then meeting up with like-minded people, John Leddy, Chris Myers, Robert Louse. That's how it basically all started. And it takes many, many years to develop that skill. I tell the young guys now and girls, start early. And I think you need to start early because it's a skill that you develop over many, many years, and you never stop learning about ultrasound. And I think really it's the future of. It's an important component of training in MSK medicine, be it physiotherapy or sports medicine or other areas, rheumatology. I mean, it's completely changing the landscape of rheumatology at the moment, as far as diagnostic and potentially also monitoring. So I think the sky's the limit with point of care ultrasound, in my opinion, and also point of care interventions. I'm just starting a new clinic in the NHS where I'm doing ultrasound guided interventions, and there's at the moment a 3 to 4 month waiting list to see someone to have an injection. So we're trying to sift through that waiting list and it's because I've got that skill of ultrasound guided injections that I can do those clinics.
Yeah, it's interesting. How do you balance your work then with NHS, private? I know you're a busy man.
Yeah, I mean, I really like the diversity. So I really like the fact that every day is not the same day. So I work. I'm at the clinic here. This is One Welbeck, which is a private sports medicine clinic. I'm here Mondays. I go to the army. I'm working in the army 2 days a week at the moment with COVID, and then I go to Institute of Sports, Exercise and Health. And then also doing some research and then doing a little bit of NHS work. So it's a variety, and I think that's one of the positives of doing of working in sports and exercise medicine is is this ability to pick and choose where you want to work. And I think some people say, oh, well, you're limiting yourself because sports and exercise medicine really doesn't have its own area in medicine. But actually, that's not true. And I think the evidence would suggest that, conservative management is probably as effective as many surgical procedures. So actually, what I see in the future is more of a demand for practitioners that have an expertise in managing chronic musculoskeletal conditions. So I don't think there's going to be, certainly the military needs that, the NHS needs that, private, there's demand there for us. Private insurance companies see our value. Then there's the ultrasound guided intervention area. So there's lots of different areas. I think it'll only increase in demand.
And yeah, on that note, how do you keep up to date with things, especially in the current circumstances of not being able to go to conferences and so on? Has that been harder, easier because it's online?
I think I actually a lot of my online stuff has been through Twitter. I actually quite enjoy seeing what people post. I get invited to a lot of conferences, and that's really helpful because a lot of those conferences are often multidisciplinary, so you often get to hear other people talk, which is quite lucky for me at this stage. And then I pick and choose sort of conferences that I go to. At this stage, obviously, because of COVID, it makes it a little bit more difficult. But important to keep up to date, always learning, learning about. I've been lucky enough to collaborate with some fantastic Spanish practitioners that doing some really great work with muscle injuries and tendon injuries and sonosurgery, and it's fantastic. And that's part of that is because of being in the UK. If I was in Australia, I wouldn't have that opportunity.
Yeah. So what are your plans then? Can you envisage you're going to be in the UK for a while, or just see?
Well, I think I'm not going to go back to Oz. I think I've got a little place in Spain as well. So that keeps me sane, especially in the UK winter. So I think I'll stay here, and I'm not sure what I'm just going to continue on with my interest in ultrasound guided interventions, do a bit more research. I've got some interest in hip and groin as well, so I'm looking at starting up a clinic there. So there's a few avenues I'll be looking at. So COVID might give us a bit more of an opportunity to do other things.
Yeah. And then just going back on terms of the tendons then, was that a particular condition? Was that the people that you came across that drove that particular initial interest?
Well, as I said, I met up with Hakan Alfredson, and really, prior to that, I was working in Melbourne, working in Alfredson, and their interest was in tendons because that's where really, particularly in Australia, that's where it all started, pretty much with the research in tendons. So I had a bit of an exposure there, which was fantastic. I still remember Joel giving a talk in, I think it was probably, 2001 or something, many years ago, talking about management of tendinopathy, and I still remember her sitting down and giving us a lecture on it and general principles and so forth. So fantastic experience. But then when I moved to the UK, I was meeting up with Alfredson. That gave me the opportunity to expand that. And obviously, when you're dealing with someone who is really top of their field in that area, it gives you opportunity to then do research and look at certain areas that we see day to day in patients and go, okay, well, why is that? And maybe we should look into that and do some research on that area. Or and certainly that's how that interest developed.
Yeah, it's interesting whether it's driven by the people you meet or the actual physical interest in the actual body part, or
yeah, I think it's just a combination of just luck, really, and the people that you're around at the time, and you get moved into a direction that I think you just go with it, and that would be my if someone asked me what should I do, I say just go with what you feel. If you feel this is the right thing to do, I always say you never regret what you've tried. Like if you try something, it fails. Okay, well, you know that's not right for you. But you may regret something that you didn't do because you're apprehensive about it or you didn't want to do it. So I always tell people, give it a go and just see. And if it doesn't work out, it doesn't work out. You know, it's not for you. I don't think you regret trying something and it failing.
Yeah, no, it's a good note to finish on. Positive outlook.
Yeah.
Well, no, thank you very much for that. It's been really interesting hearing about how you came to where you are now. So thank you very much for your time.
Thanks for that. Cheers. Thank you.
Cheers.